All right, so here we are. Welcome to today's free monthly webinar. We've been doing webinar Wednesdays once a month. The um, that's been the protocol thus far this year. And you can see that today's topic is exploring youth wellness promoting prevention programs. And you'll be getting this handout and you'll be getting a link to the recorded webinar. So I'll send you those things today. I'll email you. I'll post them first on our website, then I'll email you so you can go and download the handout if you want it. You can share or listen to the recorded webinar. Okay. Listen, anytime you have any questions, please go to the Q&A and ask a question. I will be going to look at that, and I'll take your questions or comments as they come in. Go to the Q&A if you could find it on your toolbar. And just in case you have anything that you don't understand or you want to make a comment to your peers, feel free to do that. This is your 30 minutes, 60 minutes, whatever time we spend today. So you can see today's session objectives. We have two of them. The first is sort of a lengthy one, but let me go through it with you. It's to explore evidence-based substance use and misuse Prevention Plus Wellness, that's PPW if you don't know by now, PPW Prevention Plus Wellness programs that are designed, uniquely designed, I might say, to promote protective wellness enhancing behaviors, including physical activity and sports, breakfast and nutrition, sleep and stress management. And these programs are actually motivational screening and brief interventions, and they target alcohol, marijuana, e-cigarettes, opioids, and other substances. And we have these programs for children, for young adolescents, and older adolescents. So I'm going to give you an overview of all that found on our website, preventionpluswellness.com. And then secondly, the second objective is to describe how to select and implement one or more of our youth PPW programs in your local school or schools and community. So that's what we'll be covering today. And the first thing we're going to look at is to walk you through the Prevention Plus Wellness youth programs that we have on our website. If you want to check them out yourselves, you just go to preventionpluswellness.com. And on the top, you'll find youth programs, and you can click on that. There's a drop down, and you can go through all of our youth programs. Okay, now before we do that, before I start describing and walking through all those programs and how to select them, how to use them, etc., I have a brief poll for everyone. So let me go ahead and pull that up, and that'll give us a little bit of information on everybody, and then we could tailor some of the comments and discussion around the responses. So I've launched the poll to you. It's an introductory poll. I think there's 5 items, so it's a little bit longer than we typically have, but not that long. So if you don't mind, if you are at a computer, if you are at a device where you can answer, please do. We'd like as many people to respond as possible. And so I'm going to wait for everybody to have a chance to do that. You'll need to scroll down to see all 5 items. Um, okay, and I'm just give everybody a few minutes to do that. And again, scroll down. They're very simple. I think they're all, or most of them are at least multiple choice, so you can answer more than one item. It's our introductory poll. And so please do participate if you have an opportunity to do that right now. It looks like 48% have participated, over 50% have. That's amazing. Let's see if we can get that up a little bit higher. So we're at 55, 57, 60%, 6 out of 10 of you, 64%. That is fantastic. If we can get maybe at least 7 out of 10 of you to participate, that'd even be better. So we're at 68%, 70%. Woo! Awesome. Thank you, thank you, thank you. So we've got 75%. So three out of four of you have participated. Just give you another minute or two to finish. For those of you that have just started, you still have time to complete it. We're at 79%. That's almost a record. I think 80% is a record. So boom, boom, we've done it. We've created a new record here at PPW. We're at 81% participation rate. You guys are awesome. Thank you so much. Thank you for allowing me to be your coach and to get you fired up to and for you to participate. We got 81% of you have answered some of these questions. So I'm going to stop at this point and I'm going to share the results with you. Now, unfortunately, the it's really small on my computer, so it's a little hard for me to read it. So, but no, question number one, which age groups do you mainly target when implementing your prevention? And over the largest percentage of you, it looks like, well, what is it? 83% or so said middle school. And that's typical. I mean, if we look across the country, at least in our experience, uh, prevention is being implemented primarily in middle school. And look at that, it's followed by high school, and then that's elementary school, and then there are some others. So you may be implementing it with young adults. We do have young adult programs and adults and so forth. So middle school, high school, elementary school, that's what we're focusing on today. So I'm glad you're here and I'm glad you're registered. Question number two. Which drug prevention topics are you most interested in discussing? E-cigarettes. Yes, it's definitely a problem. Majority of you said e-cigarettes, and that's followed closely by alcohol, which is the number one substance of use among young people, and that's followed by marijuana and then opioids. So those topics, we'll discuss all of them. We have programs for all of them and then some. So thank you for answering that. E-cigarettes, definitely alcohol, marijuana, opioids. The third question is, how do you prefer to implement drug prevention to your youth? And almost all of you, 94%, said in-person groups. And then there was another set of you saying in-person individually. So over a third of you said that. So that's good. And then live virtually as well as online on demand followed that. They're about the same percentage. And we do have programs in all of those. And so we'll focus on that, implementing in groups, individually, as well as virtually on demand or live. So fantastic. Thank you for that feedback. And question number four, what other drug prevention strategies do you or would you like to use? And it looks like we're pretty much tied at parent training and youth leadership training. Parent training, youth leadership training are the two that you're most interested in. And also just followed closely by media campaigns, and then also youth activities, youth activity workbooks. But quite a few are interested in that as well. Looks like over half of you, in fact, and then some others. I'd like to know what those others are. So there's a good percentage here. What do we got? 30, almost a third of you said other strategies other than parent training, other than youth leadership training, other than workbooks, healthy lifestyle workbooks, other than media campaigns. So I'd love to hear, for those of you that said other, I'd like to hear what you say to that. Either in the chat space would be fine. So just if you don't mind, go there and say what are these other strategies that you like to use. I'd like to learn from you. Last question, number five. What do you or what do you or would you like to implement uh, prevention programs. So again, I apologize, it's really tiny on my screen, I'm having a problem reading it. And it looks like the majority of you, almost all of you, well, you got 79%, said in existing school classes. So where do you want to provide these programs? Existing school classes, and that was followed by after school. School classes after school, that's where the kids are. So that makes perfect sense. But then also that was followed by drug diversion programs. So kids that were caught using, that makes sense. And that's followed by school sports and also the last item, which is homeroom or similar settings. So all of these were important. All of those related to schools and classrooms, obviously number one. But you're also interested in after school school sports, drug diversion programs, and even homeroom. And so we could talk about all those if you'd like. Thank you guys for participating. I really appreciate it. And so I'm going to ditch this, see if we could ditch this. Uh, okay, I'm back at it. So hopefully you can see again the slide here, the handout for today's session. And so I'm gonna walk you through the programs now. So let's start with the single session programs. By the way, now just make sure that you can see this. Can you see this slide? Give me your hand, give me a hand up, hand wave. You can see this slide? Okay. All right, so single session programs. So here they are. We've got one, two, three, four, uh, four of them. So we've already discussed in the previous webinar our sport alcohol and drug and our sport alcohol and cannabis programs. But let me just reiterate those. So the original program was sport, by the way, sport's an acronym. It stands for, as you can see there, substance prevention, optimizing resilience training, or resiliency training. That's why we say sport. So it can be used with kids participating in sports. It's for all. It's a universal prevention intervention. So it's not necessarily just about sports or just for kids in sports or athletics. It's a universal prevention intervention, which is used both in that setting and also for high risk youth, like in diversion programs. So the sport, alcohol, and drug programs are an initial program, three age versions: high school, middle school, elementary school. Then we created also a single session sport, AC, we call it, alcohol and cannabis. Same length of time, about a 45-minute presentation, two versions, age group versions, high school and middle school, as sport AC, alcohol, and cannabis. And again, so you got the sport, largely alcohol communications, although we did find in the research outcomes on tobacco and marijuana and promoting healthy behaviors, even though almost all of the content was linked to how alcohol interferes with these desired future images of themselves linked to their health promoting behaviors. And then Sport AC, alcohol and cannabis, is alcohol and cannabis messages within the same 45-minute presentation. Then we have, and this was the priority for many of you, vaping. That's our e-cigarette program. Again, it's a spinoff of sport. It's a 45-minute presentation. You can present it in any setting, even in school, classrooms, individually, uh, virtually. You could even break it up and implement it. We have one group at least that we know of in the country that's implementing in three pieces, three components within these brief 10 or 15-minute homerooms and similar settings. So that's the vaping program. Three versions: high school, middle school, elementary school. We got a marijuana prevention plus wellness program, three versions, again, for children, for young adolescents, for older adolescents. And then lastly, we have an opioid adolescent program. So those are our single session, roughly 45 minutes, depending on how much time you spend on goal setting and et cetera. But you can get them to be very brief and practical in school and community settings. Uh, okay, now we have two multi-session programs, Sport 3 and Sport Health Behavior. So Sport 3 is our three-session program. What we've done is we've collapsed the sport program with the marijuana program and the vaping program. So it's three lessons, three meant to be three consecutive weekly lessons, alcohol followed by marijuana followed by e-cigarettes. That's Sport 3. And we have three age groups again, high school, middle school, elementary school. So that's Sport 3, three-session program. And so if you have access to kids for three sessions, then that works well. Sport 3 is a doable program for you. If not, if it's just too difficult to get into these busy school settings, our single session programs are ideal because you could almost always get into a busy school setting for one session, one classroom session, one individual session, one school sports session, creatively implementing this prevention plus wellness program within the schools in a single period for each young person. So, two multi-session programs. We talked about Sport 3. The other is Sport Health Behaviors. That's six sessions. Sport Health Behaviors is six sessions. It's our more health forward program. Three sessions on different types of physical activity, two on nutrition, and the last one is on sleep and stress management. And three age versions again, high school, middle school, elementary school. That's if you have access to youth for six sessions. It's one of the more popular programs for like a health education setting. By the way, we do have organizations that will add these, implement these one after another. I'm trying to remember the term for that. So you got sport, health behaviors, six sessions, then followed by, or either direction, doesn't matter which one comes first, sport 3, and then add to that even opioid. So you can actually have 6 plus 3 plus 1. So you could have up to 10 sessions if you wanted to. And we do have some organizations that do that, that do have access to kids for multiple sessions and do want to use all those three programs in particular that, but you can add and subtract them any way you want. You got a lot of flexibility with our programs. What are some other programs in addition to those single session and multi-session programs? Two in particular I wanted to highlight. Youth leadership training, that's under our youth program. So that's a single session training program. So really we offer two ways to train youth leaders in prevention. Youth leaders, service experience, whatever you want to call it, or both combined. So we've got a youth leadership training program. It's PowerPoint driven. It introduces youth to prevention plus wellness model. They learn about prevention, they learn about wellness, they learn about how these concepts interact, and they learn how to promote within their peer group, in person and virtually, how to promote prevention and wellness. And so it's a very practical kind of a strategy. It gives them some tools. So it gives them some ideas as to how to talk positively about the health habits. It gives them the goal setting, and it gives them the goal setting tools so that they can share it with their friends to help their friends initiate avoiding substance use and participating in protective healthy behavior. So that's a really good single session training youth leadership in PPW. The other leadership experiences we do have across the country of various organizations, schools, and behavioral health organizations and prevention uh, organizations, et cetera, and agencies that will train youth in usually our single session programs. I'll put them up again: sport, alcohol, drugs, sport, alcohol, cannabis, vaping, marijuana, opioid. Train them in that single session program, and then what they'll do is they'll go into classrooms or groups of youth and present that one lesson. Now, this could be classrooms, this could be a sport team leader presenting it to their team members. So you get a lot of flexibility. And that's another way. to train youth in the prevention plus wellness model as leaders and give them that tremendous leadership and service experience where they act as role models for their peers, but in a more formal way, especially if they're trained to implement, let's say, the vaping program to their peers in a classroom, after school, whatever setting, or they're trained in the youth leadership training PPW. The other program we have is we have two options of our faith-based program. One's called In God's Image, the other is a higher power. In God's Image, a more Christian based, a higher power is a little more secular, but either one, it's faith based and it's a great program if you want to present prevention and wellness within any kind of religious or faith setting. All of those are our youth programs. Okay, so what is included? What's included in one of our youth programs or any of our programs for that matter? So the first thing is you get a manual. You get a physical manual or you get a digital manual, and the manual has within it scripts for implementing your program in a group, in a classroom, in a team, whatever you want, or also a script to implement it individually. Now, individually, you could implement it in a high risk setting or just youth individually. You can pull youth out of classrooms, implement it one on one. So you're really implementing it as an expert in that particular way, or you can implement it again in a group setting, which is more efficient. So you have tremendous flexibility and the ability to reach almost all youth in your schools or region to have a public health impact. So that's really important. So fidelity is much more practical with PPW programs, these brief motivational interventions, than it is for a more lengthy 15 session, 30 session, whatever, typical curriculum, drug or health curriculum. So what do you get? You get a manual. Again, physical or digital, has the scripts in it. You read the script. For implementation, we'll talk more about that in a minute. And then you get the materials that comes with that, which are the downloads, the slides. It is slide driven, so you show the slides, you read the script, very simple, and all reproducible materials. So it's a one-time purchase. You don't have to come back and keep buying materials for youth unless, like, say, you wanted workbooks, but you don't need them. Everything is in your single purchase of your materials. And we sell these on a per facilitator or implementer basis. $5.99 is our typical price for a physical manual with the materials, reproducible materials and slides. Everything you need. You buy one manual for one person to implement it. They could implement it with countless youth for as long as they want. How about training? Training is not required, but it's highly recommended because of our unique screening and brief intervention motivational format. We found training to be really, really important for people to understand how to best implement it, to understand the model, to understand how they could tailor it, how they can evaluate it. And the most popular training is our on-demand self-paced training. It takes an hour or two. It's $249 per facilitator. Now, if you buy multiple programs, you can get multiple trainings, but our model is so similar, we really emphasize at least one training. So you can save yourself some money and not necessarily have to have training in sport, alcohol and drug, and vaping and marijuana. But we do want you to train. We do highly recommend training in one program. You get the core concepts, you get the theory, you get steps for implementation, evaluation, everything. One training online, very cost effective, very practical. We highly recommend that. That's $249 per implementer for training for one program. Okay, any questions about what we offer in terms of programs, single session, multiple session, other programs? Any questions about what's included in your purchase with your manual and materials or your training? When I said your manual could be physical or digital, if you buy a physical manual, it's $5.99. If you buy a digital manual, that's where our licenses came in. We presented that last month. A license, you get access to a digital manual. That way, everybody can have access to it throughout your entire region. And that's why the license can be very cost effective. All right, let's go down now to the next topic, how to implement. Literally, here's how you implement. You read the script and you show the slides. It can't get more easy than that. It can't it can't get easier in terms of implementing with fidelity across time and programs and implementers and settings. And so, how do you do this? You can do this in groups, like we talked about already. You can implement it in existing or classrooms, or you can pull kids together, or it could be after school, or it could be sports settings, or it could be boys and girls clubs, or YMCA's, or juvenile justice. Summer's coming. It could be camps. It could be clubs. It could be wilderness experiences. PPW has been implemented in absolutely every setting you could think of, and in group settings. Also, you can implement using the manual script individually. This is where it's more tailored. You can implement it as an expert, that's screening, brief intervention, referral to treatment, because we do include in your programs a validated screener craft, so you could implement that in addition to the PPW screener. PPW screener is designed, very brief, 5, 6, 7 questions. It's designed to get youth to think about their health habits, increasing reflection and awareness. A validated screener like the craft, which if you implement this one-on-one, you could implement the craft, and that will help you screen for those youth that are at higher risk for substance use. And then at the end of your presentation of your PPW program, you could refer those that were screened for higher risk onto additional services. It could be more assessment or counseling or treatment or what have you in your particular organization. So you can implement in groups, you can implement virtually, individually, you could implement virtually live, like on this format, Zoom or Microsoft Teams or whatever. You just show the slides, you read the script, very simple. You can do it to one individual, you can do it to groups sitting together or on different devices. And then lastly, we do have online, on-demand interactive courses, which can help you extend your reach to more use. So to give you one example, up in Georgia, one of our providers is implementing sport, alcohol, and drug program in group settings to all of the middle schools in their region. They have 2 staff members, so they're very busy, but they wanted to reach out to the high school. So they took the sport interactive online program and they send those program links to the high school teachers and coaches and counselors and nurses. So they're focused on implementing sport middle school schools in classrooms, and then they send the link to the high schools so that that could be shared and it can be implemented on demand virtually there. And so they could really increase their prevention footprint by using that combination of in-person implemented as well as our optional online on-demand interactive courses. All right, next topic. Let me know if you have any questions. Go to the Q&A and drop in your question. Next question is, how can you select a PPW program that's best for you in your organization, your agency, your setting, etc. So we've got this tool selector. I'll give you a link to it in a second, but it's very simple. It's 7 steps. So let's go down the steps. I'll go through them with you. Step number 1, and then you go to the right. What's the action there? You're going to identify the target age group or target age groups. And so what's the details? What's the purpose? Here's where you decide, do you want to implement programs within children, elementary school age, young adolescents, middle school age, or older adolescents, high school age? And of course, we also have programs for college or young adults in general, as well as even adults. So identify. Now, if you have a budget, you may have to prioritize. And as you see, most people are implementing, most of you, at least today, are implementing middle school, followed by high school, followed by elementary school. That's fine. I'll just say that the older the youth is, the more at risk they are. So the greatest amount of risk is among those that are young adults before risk sort of plateaus and then starts going down, followed by high school age, followed by middle school, followed by elementary school. So if you're working with school age youth, high school would be the greatest risk, followed by middle school, and then elementary last. So choose your age group or groups. Number two, second step is to look up program options. You go to our website, preventionpluswellness.com. You click on the youth programs. You'll see the drop-down menu, and you'll be able to explore all these programs that we talked about today. Single session programs, multi-session programs, even youth leadership training, even faith-based programs, and of course others we haven't talked about, which we will in the future. The parent training, the media campaigns, and other things that we offer. So what you want to do is identify which program or programs you want. And then number three, determine the quantity. So let's say that you want to implement sport, the original sport alcohol and drug program. You've got two facilitators. You can buy ideally, you'd buy two manuals, one for each of them, and an online self-paced program implementer training for each of them. They get the training, they get the manual, they hop on to get the training done in an hour or two, and they're ready to go. You could request pre-post survey, online surveys to track your program outcomes. Excellent. So, but it's very simple. If you have more, let's say you wanted to get a sport, alcohol, and drug and vaping. So you can buy two manuals for both of your people, or you can share a manual. It's not ideal because we found out that when you share a manual, manuals get lost that way. But if you've got a tight budget, you can share manuals with the digital downloads. That's fine. And then if you have those two programs, the vaping and the sport, your two staff members should be trained in at least one of those programs so they understand the PPW model and steps for implementation, et cetera. So that's my recommendation there. That's step three, determine the quantity of your programs and training. Step number four, select the training. Again, I recommend at least training in one program. Now, some of our programs are quite a bit different. So our single session programs, they're quite similar. Sport AC, alcohol, cannabis, that is, marijuana, vaping, they're all adaptations of sport. The opioid adolescent program is a little bit different. So that's a little bit different. So, if you have sport and you have opioid, you may want to get trained in both of them, but that's up to you. But if you have the single session program and then you have a multi-session program, you definitely want to be trained in both because the multi-session programs, that is sport three sessions, and sport health behaviors, 6 sessions, are quite a bit different and obviously lengthier than the single session program. So if you have a multi-session program and a single session program, we do recommend getting trained in each because they're quite a bit different. And that training will give you the time to walk you through everything so you understand it completely. And then you practice your scripts and you're ready to start implementation. Let's see, step five, explore licensing. So if you have three or four or five facilitators, or if your goal is to open up training to anybody in your region, other schools, other teachers, nurses, counselors, coaches, um, prevention specialists. If your organization wants to open it up so that you're not trying to present the program to everybody, but you're also getting other people trained to implement it, thereby really having a much greater prevention footprint, then a license is for you. So a license is for you. We talked about that last week. So, and that's where you get a digital, anybody can be trained during the license. You send them to the training portal. Anybody can receive the access to the materials digitally. So that's the licensing. Step six is review the online program courses as an option. You know, if you wanted to implement to some youth in person, and then you wanted to send the links to others, you could expand your prevention footprint by also ordering some of the online interactive courses. And then lastly, number seven, reinforce the messaging. After you're done with your single session program or your multi-session program, now's the time to have youth receive supportive messaging on the same prevention plus wellness model from others by doing parent training, by using a media campaign. By the way, a media campaign that the youth can both receive it, but they can also help implement social media messages because they're experts in it. Healthy lifestyle workbooks chock full of extra activities addressing all the target health behaviors of PPW, not just substance abuse avoidance, but physical activity, nutrition, sleep, and relaxation or stress control. So those are your seven steps. You can go through those. Very simple. And now here are some resources for you. You can download the program selector, this thing right here, the seven-step thing. You can make it actually download a copy of that. There's the link. There is a link to a free ebook on how to provide drug prevention in busy schools. So you can have that ebook and you could so you can have slides and see that. And then also we have by the way, lastly, we're celebrating 20 years of Prevention Plus Wellness, so we're offering a grant matching program. So if you write Prevention Plus Wellness materials and training into your grant every year of the grant, then we will double that. So it's sort of like a BOGO. If you write in $2,000 worth, let's see, buy one license, we'll double it and give you a second license. So you can really increase your prevention reach with our new matching grant program this year while we celebrate 20 years of prevention plus wellness services across the country and abroad. So if you want to learn more about all these youth programs, you go to preventionpluswellness.com, and on the top there'll be youth programs. You click on that and you'll have a drop down and you'll be able to look at all these things that we've discussed. So this handout I'll be posting on our website. I'll be posting our recording. I'll send everyone here an email to where that is. Let's see if anybody had any questions. I'm going to go to the Q&A and no questions, no Q&A. Now's your chance to, if you have a question, if you have a comment, go to the Q&A and drop it in. I'm going to check the chat space and see if anybody has said anything there. Might be open to offering it after school. Oh, a library. Oh, that sounds interesting. Anxious to explore your website. Well, I'm thrilled about that, Tammy. Thank you for saying that. Library, I have heard that. Library is a good idea for implementing a brief a whole health prevention plus wellness program. And it could be self-implemented with the online courses, interactive courses, or you could present it individually or in a group. The library will give you some space usually, so that's a great idea as well. Oh, here's a lengthy response, some feedback there. I'm going to have to take a time to did not like how dry it felt and how little they got to know each other. For the second round next week during school vacation, we decided to start earlier and interactive fun activity. So here's the thing about that's a good, and I appreciate that comment. So prevention plus wellness programs, again, they're a motivational intervention. The goal is to design to get youth motivated to change their behaviors and then set goals to initiate that behavior change. The process is to link how substance use, whether that be alcohol or e-cigarettes or cannabis or opioids, or others interfere with each of the targeted health behaviors, physical activity, nutrition, sleep, stress control, and to target desired future images of themselves, being more fit, active, healthy, successful. And then again, goal setting to avoid the substance use and to increase protective health behaviors. Now, there's three opportunities for participation. Number one, they complete their own screening survey to think about their health habits. Number two, you ask them questions about their health behaviors like physical activity. What would you like to do for a different or more physical activity? So you get them to reflect again, always taking it back to their own health habits. And if you have time, you can have everybody or multiple people respond to those reflection questions. And then lastly, goal setting, where they set their own goals designed specifically to meet their desired needs, to get a little bit more physical activity, 15 more minutes of sleep, eat breakfast throughout the school week. Whatever that is, you're there to help them. So interactive and all of that. Now we have the healthy lifestyle workbooks if you want more activities, more things to do. But the key thing here with all PPW programs is to initiate that first motivational lesson, and then you can go from there. That's really very critical. So how to implement your program and keep it interactive. The training is very important to that. So that's why we highlight taking at least one online self-paced program implementer training. I'm going to look at these on my own because it looks like there's some great comments from you. It's always confusing to me at first to see sport when this presentation is not about sport. I'm going to correct that. It is about sport. One of the main emphasis in prevention plus wellness programs is how to lead a physically active life. So that means movement for those that are not into sports, and sports for those that are into organized sports. So it's about physical activity, movement, it's about nutrition, it's about sleep, it's about stress control, and all of that is interwoven within the drug prevention messaging. And sport, the acronym, again, you could implement it within sports settings or not. That's up to you. Because here's the thing, three-quarters of high school students, adolescents throughout the country, three-fourths do not get the minimum required amount of physical activity. They're not moving their bodies. Three-fourths are not eating breakfast every day, and three-fourths or more are not getting minimum 8 hours of sleep every day. And of course, lastly, all of them, I would suspect, I don't know what the national data is because it's not necessarily collected, but they all experience um, stress in their lives, daily stress. So that's why this whole health prevention plus wellness program, very, very important. So I hope some of my clarifications are helping. Let me know if they're not. You can go to let me just check now, see if there's anything in the Q&A. If anybody added anything to the Q&A. I'm going to shut down the chat. I know maybe the chat's a little bit easier for you guys to use. And maybe some of you don't have access to the Q&A. I don't know, because see, there's no comments in the Q&A. So I'm going to go back to the chat space and then walk through a couple more of these. So that's it. We're out of time. If you have last chance, if you do have a question or comment, go to the Q&A. I'm going to see what people have said in the chat space because that seems to be um, where people are making comments. I may miss your comment because let me open my chat space up and I can see a little bit better. Um, so I answered the Astrid. And I think, again, to the key here, and getting feedback is really important, Astrid. So I'm glad you're doing that. Hopefully, you're implementing the pre-post survey so you're getting actually uh, written feedback from the kids as to what they liked, what they didn't like, because you do want to know what they liked as well so you can promote your PPW program. And then also some actual data on risk and protective factors. So hopefully you're using those surveys to collect and monitor that data. Either way, so you're getting some feedback that they wanted more exercise. Yes, great idea. Warm up exercise to do beforehand. So if you're coming in and you don't know your group, a little warm-up exercise is good. And let me suggest that could be anything you do, or again, our healthy lifestyle workbooks is a great tool because they have wonderful exercises that address all of the target health behaviors of a PPW, physical activity, including sports, sleep, nutrition, stress control, and alcohol and drug avoidance. So, but the key is you want to motivate them, you want to get through this strategy, you want to make sure they have the screening survey, that they're responding to the discussion questions, that they do the goal plan. And if you have time, you can have them share each other's goal plan and help each other set healthy goals. And then you, as the instructor, can co-sign them and have them take them home to have them co-signed by somebody at home. So really, really important to follow that strategy. And if you do that, I think you'll find out that they'll enjoy tremendously the opportunity to not just avoid substance use. Our experience is that if middle school kids, especially high school kids, have heard prevention messages don't use, so a strategy that emphasizes how they can be better, feel better, and do better in sports and in school and relationships in life, like a whole health PPW program, is very appealing to them. So do collect your pre-post survey. Do ask for it, the links to the online survey, so you can actually assess program outcomes and feedback. I'm always confused to me if we've answered that. Also, if I didn't answer that, Astrid, about your confusion about sport, let me know. It's an acronym. Uh, we do have organizations throughout the country implementing it within sports settings. We offer other evidence-based drug prevention programs. Good. Uh, Evidence-based programs of any kind are essential. Our programs are unique. You could see the difference. You could see how you could use them to increase whole health. You could see how you can use them in busy school settings. Uh, and so you don't need to not use your existing evidence-based program, but you could add PPW to your existing prevention program list, because it's a great resource that you'll likely use more than other prevention programs. That's what we think, and that's what we've seen by our providers. But we're not discounting other evidence-based programs, and we do highlight evidence-based programs over non-evidence-based ones. Other include education within faith and community. Said, oh, thank you for that. Excellent. Okay, and the rest is, I think, um, introductions. Last chance, I'm going to check to see if there's anything in the Q&A. No questions, no comments. Thank you all so much. God bless you for what you do for youth and families in your region. I'll reach out to you with an email shortly today, and you'll have access to this webinar handout as well as the recorded session. If you need anything else from me, let me know. Contact us at info@preventionpluswellness.com. Or go to our website, preventionpluswellness.com, walk through it, and at the bottom, we have our telephone number, our email, and other contact information. Thank you all for joining us. Have a wonderful day, everyone. Bye-bye.